So we're here at the 2011 American Indian Health and Family Services Health Fair, and I think it's really important to have this event because as indigenous people, we always had a concept of what's health and wellness in our communities and what it looks like, what it feels like, and how to share that and how to promote that in our communities. That's something that's blood memory to us, and I think having an event like this in Detroit really creates space for those things to be relived and renewed.
The Healthy Families Fair was an event established to increase the health and well-being of the community members by offering health services and screenings, as well as providing information on local community agencies and resources. The health fair offered opportunities for those in attendance to watch food demonstrations on how to make healthy food options such as smoothies, ground turkey nachos with salsa, and buffalo sliders. Exercise demonstrations were also offered, which included yoga as well as traditional dancing.
Well, my name is Tyrone Chandler. I'm a certified medical assistant here at American Indian Health. Dr. Miller has a station over here, so if you would, can you walk us through the station?
Absolutely.
And give us a little tour of the instruments that you use.
We're actually checking to see what the history is. If a patient has diabetes, we definitely want to dilate the pupils to make sure that there is no bleeding going on in the back of the eye. We're also checking the visual acuity to make sure that there's not a decrease in vision. We also, over here, we check, this is a screening device that we can check for glaucoma. The highest prevalence of glaucoma is in people of color, including African Americans, Latinos, and Native Americans. So it's very important to have the pressure in the eye checked. And if you have diabetes, it's mandatory that you have a dilated eye examination every year. Because if you have diabetes, if it's uncontrolled, you can get hemorrhaging in the back of the eye.
All right, so now we're going to go check out the flu station, the flu shot station. Welcome to the station for the flu shots. Here, Harriet, which is our lead medical assistant and clinic manager.
I believe in immunization. Immunization saves lives. I also encourage that all people would get Tdap because that's for pertussin and whooping cough. And you have little children around. We need to have more parents and people educated. So come get your flu shot, get your Tdap, and don't forget your Pneumovax.
So, next station we got is the massage, the foot massage station. And Geraldine, can you tell them a little bit about the foot exam and what are you doing and the instruments that you use?
Yes, sure. Well, I'm doing 10-minute foot massages, and it gives us a chance to get a sense of people's sensitivity on their feet, and gives us a chance to check to make sure they're healthy and no neuropathy at play. And if we see anything that looks concerning, then we can refer them to one of our providers. But overall, it just gives people a chance to get pampered and relax a little bit.
We have Ben here, and Natalie, and Kendall, and Nabil? Yeah. So can you guys tell us a little bit of what you're doing?
We're just testing everyone's visual acuity so that they can go in and see the optometrist, and the optometrist has a little background information on them before he takes their eye pressure. So diabetes prevention screening. That's what we're doing.
And over here we have Stephanie. She's our CHR. She's doing health screenings. So Stephanie, can you tell a little bit about what you're doing?
We're doing blood pressure, blood sugar checks. This is our medical student, Luke. He is assisting me. The client comes in, we check their blood pressure, and then we check their blood sugars. It's a whole screening process. Sometimes people don't know if they're diabetic, and we just give them the range of what their sugar should be at. The same thing with blood pressure. Sometimes people don't always follow up with their doctors, so it's good to see where their levels are at. And we can give recommendations that they need to go follow up with their primary care.
And that's the wonderful medical world in the healthcare.
Well, it's been an amazing day. We had so many people come out, and the weather couldn't have been better. And it was great to see families here, lots for the kids to do, and a lot of pampering, a lot of fellowship, and a lot of good, healthy feelings. So great job, American Indian Health, for another year of hard work at our health fair.